Hello, this is Athena Jezik. I'm going to be showing you something about an injury post-op and letting you know what's happening here with Diana.
Hi, I'm Diana. About 4 months ago, I decided that I was going to go roller skating at a friend's birthday party, and I was doing a turn and fell and broke my wrist pretty badly. 6 days after I broke it, I had surgery and had to have a plate put in it. And there was a pin that ended up where it wasn't supposed to be, and I had limited range of motion. So once it healed enough, we had to go back in and they were going to take just the pin out. But I waited a little longer so the bone would be healed enough to remove all of the hardware. And so Athena did a lot of work at that time on my edema, just getting a lot of lymph moving. And I was really banged up. There was a lot of trauma from the break, and then there was the trauma from the surgery on top of it. But there's some bruising and just subsequent, aftermath of the surgery that Athena is going to work on just to promote healing. And I've just found a lot of benefit from this when Athena's done this kind of work on me, and she thought it would be great to share, and I agreed.
We have her arm. I'm going to put it into a position so that you can maybe see it, and I can work at it pretty easy. Now, she did have a dressing on it, and the plate was in there. The plate has been removed. I did work her the night before the surgery, and it seemed to really help with this recovery stuff, because now that the dressing is off and it's cleaned up a little bit, it doesn't have much inflammation along here, and there's a little bit of swelling, but not much. I don't know if this is more of a bruise or more of I think this is a little bit of bruising down in this area. It looks like that. But I'm going to show you how you would work. This is, the post-op, since she's had the plate taken out. It's a pretty radical kind of surgery in some ways, because there was a foreign object in there for quite a few weeks, and it's out now. Overall, though, I really like the way it looks because of the work prior to. I do not think it would be that good. Usually after surgeries, what I've seen is especially as fresh as her surgery was, there's a lot of inflammation around the suture line, so there's not a whole lot there. But what I want to do is make sure that there's no fluid that's collecting in there, so we're going to make sure that's all drained out. And I'll be checking this side of her arm and the other side of her arm and working up into the shoulder and elbow area as well. Okay, so to start with, I'm going to just open up the nodes here in the elbow. If it was very swollen, then I would have to open it up from the clavicular node and the axillary. I'm just going to do this a little bit to keep it going, and then do some of the skin stretching here techniques. But I am going to just make sure that it's able to flow through here. So I'm going to be doing a little skin stretching down here. Now, this is something that I will be passing on in my course of how to work this a little bit more diligently and technically. If you're interested in learning how to do this stuff, you can sign up for my course. There's going to be a lot of information in the course for you to be able to address many, many issues. So I would encourage you to do that if you're called in that direction. Now we're getting down into the suture line. So here's where we want to be real careful, because the stitches are still underneath there. It's not been enough days for them to dissolve. So I'm going to just check here for fluid. And actually, I'm really quite surprised at how well this is. Usually, scarring from surgeries, post-op surgeries that I've dealt with in the past, did not have the lymphatic and the unwinding techniques done prior to the surgery. And it was always very, very bumpy right along the suture line, and this is very, very smooth. Now this has to be done with very little pressure. In fact, just going up these muscles, I'm able to feel some muscle reaction up here near the elbow, suggesting that there's some unwinding that needs to be done, because it's very jumpy up there at the elbow, so there's some connection there going on. But this is very, very smooth right along the suture line. And I do think this discoloration is a little bit of bruising, just from, it's kind of rough to have surgery. Even though doctors do their best to be as gentle as possible, it's just a rough surgery. It's very aggressive because you're going inside of the body. And I'm going to continue to move the fluid up so that it can drain into these nodes. And now I'm going to go down and find the other side of this. So I'll be pulling this and checking along here very, 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 very lightly. When you're working with something like this, you really need to know what you're doing. You really need to go into it with very, very light pressure. Now this is another one. It's very smooth along there. There's not a lot of little bumps, little ripples. It's very smooth, and I'm very pleased that that is the way it is, because that means that the work was quite beneficial when she came in the night before. Now here it's a little bit open there, so I'm not going to really go across the suture too much, but I am going to place my finger and just do a little bit of back and forth, because this will be a scar, and it is together pretty well, but it can't be handled too roughly right now. So now up here, what I'm going to do, because this does look really, really good and it's feeling good on each side, I'm going to very gently place my finger along this suture line and give it just a little bit of work back and forth to alleviate any scar tissue that's probably forming, because this will have a scar, and you want to get rid of that scar tissue as quickly as possible, because scar tissue tends to be kind of like spaghetti noodles, and it does pull a lot on muscles. When this heals a little bit more, I'll be able to work this a little more aggressively and get down into the scarring that's going to go deeper into the body, because that scar tissue down there could possibly create some restrictions in range of motion if it's not dealt with. And the fresher that this stuff is, the better the results will be in order to get rid of the scar tissue. Scar tissue that's been there for a while, it grows like spaghetti noodles, and it's all over the place, and it does really hinder the muscle. If it's attaching into the bone, it can be very painful in the bone every time you move in the wrong direction. So that's just something else to take note of. And this is feeling surprisingly good, but every time I do this, I feel something up her arm, again, closer into the elbow. So there is some kind of twisting connection that's going on there, because it is on the other side of her arm. Now I'm just going to work a little bit here and allow that to move. It doesn't look like I'm doing much, but actually it's really quite a bit of work that is being done to this area. And then this kind of a scar, this is the scar, this kind of bruising, there's a technique that you have to be very careful in doing any kind of scarring, because you can, if you go too deeply into this, you can end up creating a clot, particularly if it's a very deep bruise. You're not supposed to massage that. You're not really supposed to do anything like that on a bruise. But I have been very successful to see even deep bruises begin to flow out of that area, getting the blood moving out of that area. And sometimes it just kind of happens before your eyes. It'll work before the eyes. So we'll see if this is going to lighten up anything here. And again, it's the fresher the bruise, the easier it is to move. There's some kind of like hardening of the fluid, more like gelatinous kind of stuff that feels like it's not as easy to move when it's an older bruise. But you want to be very, very careful about the bruises particularly, because this is, there's contraindications there. But again, if you know what you're doing and you understand the whole mechanism of that and understand how the body works with the fluids and all of that different thing, you'll be able to do okay. You'll be cautious enough to take care of it. And if you're practicing this kind of thing and you hurt somebody or you give something that's not good, then you can bet that word will get out and it's going to kind of ruin your practice. So you want to make sure that you're doing what's going to be best. And I'll tell you, that muscle around that elbow joint is just wiggling like crazy. It has a lot of movement going on. Now this is the direction that the lymph would flow, but it's not a skin stretching movement here. It's more of just a brushing, because this will help the healing too, to get any of this kind of blood moved out of the way. The bruise actually looks like it's already healing because it's more of this yellowish color. It's when they are the purple bruises, that's when the biggest danger is for working on them. And the work is very light. It's very relaxing. And then I'll just go up a little more, and she does have bruising up in this area, which makes sense because this was a pretty big plate that was in there. And I'm going to continue to kind of push this coloration and see if we can get that to move. And then along there where that suture is. Now a little farther out from the suture, there's a little bit more lumpiness, but that's deeper in there, but it's not staying that way, it's moving. So that could be just little clumps of fluid, or I don't know, just tissue that's knotted up a bit. One thing I will say is it looks like she had a good surgeon, because the scar is very, very well sewn together. It fits together. Sometimes I've seen people that have it unfit, like kind of like a stitch in a garment that isn't really matching, and so it has kind of lumps in it. But this feels very good. It looks real good. And just keep on kind of just working it down. That's what we want to do. In fact, it's just, now I'm going to do a little bit more across the suture, just to keep that scar tissue. In fact, when I did that the first time, it changed the feeling of the right on either side of it. So any kind of scar tissue that was beginning to form seems like it's not going to be able to form like it would want to. Okay, that's all very good. because it's internal stitches, except right here I can feel the stitch there. But otherwise all along here it's internal. So there's, every once in a while you find a stitch that might stick out. And if the stitches have already, if they're superficial stitches and they're not the dissolving kind, sometimes they'll miss a stitch when they take it out. And you'll find it, you know, and then you want to have them go to the doctor and have it taken out. I never try to do anything with any sort of, you know, pulling a stitch out on anybody. I don't go outside of my realm of expertise on things. I'll pick it up, but then they can go to the person who is more versed in that kind of work. Okay, now I'm just going to take that up the arm and we're going to make sure. Now, I don't know, you know, sometimes I think my eyes play tricks on me when I do work the bruises, but it seems to me like the bruise is moving upward. It didn't seem like it was quite so close to that little bruise right there. Or that's not even a bruise, that's where they mark something. But it seemed like it was just more down in the area, and so if it looks like it's running up, that means that the fluid is moving. It's probably a lot of lymph as well because it's so light. I don't think it's really affecting the blood circulation at all at this pressure level. So it does look like that is changing. And the thing is if it does change rather quickly, usually the bruising will go away faster when it starts to move out like that. Okay, now I'm gonna have her turn the arm. Where is it comfortable for you? Right, is it okay there? So what she's noticed, what Diana has noticed, is that since the surgery, her arm is doing flipping better because the two bones, they have to flip. Fingers feel a little stiff and a little tight. I think she had trouble making a fist. So I'm going to do some subtle anatomy work here with the bones, and we're going to work that out and see if we can get some of the fluid that might be a little bit gelatinous inside of these bones to melt. I guess you could say that would be a good way to put it. And see if we can get some range of motion back in it. It does feel very stiff. Now a lot of this attachment stuff is gonna, you have to know that the tendons and muscles are going up along where the broken bone was, so you don't want to go really rough into it. A lot of times what I notice with body workers is that they're not really thinking surface to deep, and so they'll forget that there's also connection going on here, so they'll maybe move it a little bit more than it should be and could cause some problems with the tenderness of the muscle or tendon that is attaching into the bone. So you always have to think multi-level when you're doing this work, which is another reason why the course, if you're interested in really taking care of people with different conditions that need this kind of help, you can learn a lot in that course. You'll get through the fundamentals, and the fundamentals will give you a good way to look at the body differently, and then as time goes on, I'm going to be introducing a lot of very advanced techniques, and then you can play with them and add them, integrate them into your system of work. Now I'm already noticing here that the joints are moving a little bit more than they were. I'm not forcing them very much. I'm just feeling how they're changing. Okay, and then I'm going to see how this one is. So we're going to be working these joints to get them loosened up a little bit. I'm not pulling any traction with them right now. I'm just making sure that the fluid is melting. And the next one. And here. And then this one here. Little pinky. That one feels the least affected. And then to check, just going to be checking if we can curl it down a little more. Very gently into a tighter little fist. Begin to work that. That's going to take some time, but we'll just work it very gently. And sometimes it doesn't happen right away. It does take time. That's one thing we have to learn, that when we're healing, especially the natural way, we have to deal with the body. We have to pay attention to what the body is doing and help it along, but not push it, because we don't want to re-damage anything or cause any stress on any of this. So this feels like this isn't super tight fist yet, but it does feel like it's heading in that direction. Now I'm going to take here's a little bit of swelling through here on the opposite side, so I'll be draining the fluid here. Go back up and just a little pumping there at the elbow, and then working the fluid techniques to move that. Yeah, it's really, there's something about the feeling of something that's been damaged. The energy of it is so different. Okay. So, does your wrist bend pretty back and forth? Yeah, now let me move it instead of you. So she's getting, we're going to find the range of motion in here. Now that we have to be very careful of. But I'm going to take, a little gliding motion, just in where the body wants to do it, and a little flexion and extension motion, which is all good. Can your hand lay down? Is that okay? Okay, I'm just going to go up this arm. I'm going to take this a little bit different technique here, because I'm getting into the muscular part here, but I'm not really pushing into the muscles. This is the side that did not have the plate, so it may have been part of the broken bone, of course, because the bone was on both sides. So I'm going to just go real carefully up into this muscle tissue here. Okay, and then checking there. Now I want to check her elbow, because that oftentimes will be kind of locked down or twisted, and that's also where those two bones that were broken, it works into the elbow. So I'm just placing my fingers on the elbow in a particular position with those bones, and then allowing to see if there's any movement with that, to let that unwind if it needs to. There was a little jerk of the hand. I don't know if any of you were able to see that. And when she did that, it did a little funny twist at the elbow, and then it seemed like it relaxed in the elbow. So something did unwind at that moment, that the hand jumped a little bit. And then here we go. Because this was the area where I was feeling so much movement when I was on the other side of the arm. And that seems to be softer, as if that, whatever happened in the hand or in the elbow that jerked it, it seemed to soften the tissue a bit more. Okay, so it looks like that's about all that can be done. Yeah, this is changing now because there is fluid running through it. Let me check the fluid. There's definitely fluid now that's running this direction. And then we will put the dressing back onto the area to keep it kind of stable. Yeah, this is healing really, really well. In fact, there's one area that's already right through here. There's one area that's already across the barrier, if you could say, because that area doesn't have any kind of feeling of scar tissue from this. This seems like where the suture goes in is always the most damaged place. So this is going to be another place to work right at where this external stitch is. But when I've seen surgeries on abdomens, it's always where the suture knife goes into the body that seems to be the most traumatic area. It's all feeling good. I'm actually able to do a little bit more than I was before. I'm just checking everything. See how that bruise? See how the bruise looks like it's, I don't know, I might be imagining it, but it looks like it's a little bit longer. Looks like it's moving more together and up instead of quite so wide. But, you know, I always kind of think my eyes are playing tricks on me. Yeah, Karina has said she's here filming, and she said that she is noticing a difference in where how the bruise is patterning itself, that it is moving up. So it'll move up and then it'll be able to move out. It's actually going to probably be more into the lymph system, so some of that will be able to be filtered through the body at a much quicker thing. Now, it's good to have that disappear. It's quite bruised through here, too. But it's good for that to be disappearing because the healing process can happen better when there's not a lot of that debris there. And so I want to make sure that this is going to have a little bit of push, too. Not that that's going to show much. It's kind of an odd place. But it does seem to be changing. Okay, so we got the elbow. Now I'm going to go up to the shoulder here and just kind of see what happens here. This is mainly to make sure that the alignment is going to be proper. So the subtle alignment, again, this is a very important part. Got to get that corrected. And so I'm just holding that shoulder up here, the acromion clavicular area, and right around the joint. Okay, I've melded with it, and now we're going to see what happens if there's any action there. You know, when the way she got her arm broken, she put some pressure onto that shoulder as well, and I can feel it right now. It's jumping around, and it's twisting, and it's pulling in different areas. Feels kind of like boiling water, but not with a whole bunch of bubbles coming up, just maybe one or two at a time instead of a whole bunch of them. But yeah, it's definitely unwinding something there. So I'll hold it a little bit longer. And there's also a pulse happening, a therapeutic pulse, which means there's some tissue that is getting ready to change position. At least that's how it seems to work. And again, very light touch. So, just so you know, especially you therapists out there, understand that less is more. You're going to really do a lot more for your clients if you can get into this, especially if there's injury. Deep tissue is important at times. Deep tissue is very important to remove old scar tissue. Once it's broken up, then going in there and, pushing that scar tissue into a different position. And it's very painful if it's a deep muscle or there's something at the level of the bone. Okay, well that felt good, and now I'm going to check it with the elbow again. A little bit different positioning here, but I'm on the bone, on the two bones, and that feels pretty good. It is relating into this is now relating into the wrist and hand differently than it did before. There's definitely some unwinding going on. There was a big jump in the elbow. More jumps. Okay, so there you go. And I hope you enjoyed watching that and getting some understanding. And I will see you next time. Be sure to like, share, subscribe, and hit the thumbs up button if you enjoyed it. I want to invite you to explore my course, The Foundations of Subtle Alignment. It is going to take you beyond the work of massage therapy. It will take you into the world of the subtle anatomy. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. These techniques offer profound benefit whether you are working on people with complex issues or not. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures.